The Kent English tradition in America traces back to Sir Henry Vane, who is King Henry X. He served as the 5th governor of the Massachusetts Bay Colony, where he had an incredibly prolific year. He founded Harvard University. He had a vision of what we now describe as manifest destiny, that English would spread all over the continent, which was extraordinarily unlikely before he came here, including the founding of Rhode Island and Connecticut, which were held more or less by the British and the Dutch, of which the Dutch had ruled the world for some 400 years. And then Sir Henry Vane had a vision of a ship that was shapeless in the water at full speed. That ship, he reverse engineered a kind of calculus of a ship that was faster than the Dutch ships, could carry more artillery than the Dutch ships, and that is the British Navy that we know that defeated the Dutch Navy and went on to build the British Empire that the sun never sat upon. And that happens to be critical because Sir Henry Vane was an American knight. Not everybody knows that as part of our history. He also, he founded Harvard University, founded calculus, founded the British Navy as we understand it today, and manifest destiny. He did that with a separate accounting system from what we have today. If you look at the accounting systems that exist in America, they are reduced more or less to four big four accounting firms, of which one of them is Dutch, despite the British bringing down the Dutch. 3 of them are based in the British Isles, despite the fact that Sir Henry Vane brought an accounter system here, best referred to as Kinetaconter, which was influenced by his calculus. You can imagine, like the somatic nervous system, like the what we refer to as the pestic accounter system, or the accounting system of fear, which is what the British Navy was. It was a a locomotive high in the seas, before steam, that could hunt down the Dutch ships, and happened to be superior in Kinetaconter. When you saw the Union Jack after Sir Henry Vane, a lot of people would head the other direction because the British Navy was faster, was stronger, had more guns. And that is an American accounting system because his time in America is what influenced his development of calculus. It's what influenced his vision of modernizing the British fleet, and again left the remnant that we refer to as Harvard University. And so this Kinetaconter system is highly relevant in healthcare today, particularly for those of you that are involved in any qualitative kind of casting, any qualitative kind of somatic nervous system work, whether it's orthopedics or physical medicine, rehab, spine surgery, again any kind of hand surgeon, foot and ankle surgeon, podiatry, trace back to this calculus, Kinetaconter, where it's the unification of quality and finance, of movement, of locomotion, of transportation, and, including with durable medical equipment. That tradition, the Kent English tradition, for those of you that are orthopedists are familiar with, Charnley. Part of why the Charnley hip replacement originates from the Kent English tradition is this Kinetaconter tradition in England. It traces back to Sir Henry Vane, who actually his best ideas originate from his time in America as the 5th governor of the Massachusetts Bay Colony. It's so critical that we look at quality and finance. We look at activity of an orthopedics practice, a spine surgery practice, a hand surgery practice, along with the dollars, both. And we don't have certified public accountants that understand that. Certified public accountants have been involved in every major fraud and every major prosecution of orthopedic surgeons in America. Despite the fact that accountants don't have any medical science training at all, accountants don't have any advanced training on orthopedics, don't have accounting, calculus training, don't have advanced physics training of any kind. Us at Profi.me, we're different. I'm the author of Kairos Relativity, where I uncovered multiple errors in Albert Einstein's special relativity. which is the most important paper written in physics since Niels Bohr. For those of you that are, interested in physics, in orthopedics, you're going to look to a physicist of medical sciences, of which I'm also a published peer-reviewed pharmacologist. I'm a published peer-reviewed biochemist. My work in, Kinetaconter, unifying orthopedics medical practice work with dollars, has been some of the best work in the country. I sat on boards, including the American Academy of Orthopedic Executives, on small, closely held private groups, large, closely held private groups. The entities of closely held organizations trace back more to the Kent English tradition, where Sir Henry Vane was simultaneously King of England, which was a closely held entity. That bloodline happens to not be the King of England, because Sir Henry Vane died in 1662 during the British Civil War. And that's why we're, middle-class folks. His descendants are middle-class folks in America, and not wearing a crown. Although, on my mother's side, we say a crown, is just a hat that lets the rain in. But physician offices are closely held entities, not unlike, the royal houses. That was what a closely held entity was. And Kinetaconter is the accounting system that was lost, between, World War I and like 1991, where we're left with one certified public accounting system in America, despite the fact that there were 66 to 103 separate shepherd tribes of bookkeeping, of accounting, of balance sheets, of income statements. Kinetaconter unifies in orthopedic practices quality work and finance work in one kind of bookkeeping, one kind of balance sheet, one kind of finance. It's the highest standard of quality. It traced back to the Hippocratic tradition, where we're superior in horses. And that workability first Kent English tradition can come to your medical practice and change your financial picture forever for the better. It can also help governors. United States governors can improve the performance of the medical grade space within your state by looking at a Kinetaconter system. U.S. governors are well-intentioned people. They're good people, but they've been voted out of office with such high frequency. If you look back the last 10 years, the tenure of U.S. governors is so low, and it's almost entirely because of U.S. governors' inattention to how medical grade space is used or not used well. The Kinetaconter system is something U.S. governors can do to look at. For example, there's 180 rural hospitals that have closed since 2006, and that slow moving locomotive of bankruptcies, of closures, has correlated with U.S. governors being voted out of office, of which that medical grade space can be repurposed in a Kinetaconter system to address the healthcare problems of today, including hip replacement, something in the Kent English tradition we understand well. Those that are fellowship-trained hip surgeons are looking at this. You're familiar with Charlie. Charlie was a Kent English surgeon in a classic Kent English tradition, in the tradition of Sir Henry Vane, who founded Harvard University and also was King of England. That tradition is where the hip replacement capacity has come from in America. And we've been so successful, surgeons have gotten so productive at it, and yet surgeons have not gained all of the benefit that they could have. And so looking at a master facility plan in the Kinetaconter tradition, the Sir Henry Vane tradition, the Kent English tradition, can absolutely change orthopedics forever for the better, and it can help U.S. governors get reelected. Because U.S. governors don't have a good sense of why they're getting reelected. The top reason you're not getting reelected is that you don't have an orthopedic surgery specialty hospital that's operating in the Kinetaconter tradition. Every state can have one. We can help you build one. We've been involved in building them all over America. It happens to be really critical, not just for the constituency of orthopedic surgeons, but an acute injury clinic, which is something that I've evangelized all over America. And U.S. governors that don't have any acute injury clinics for same-day volume, working people can't get seen for their work-related injuries today, and so they show up at an emergency room and are paying way too much when they need to see an orthopedic surgeon. The Kent English tradition was always workability first, and we're trying to bring that back so that U.S. governors can, get a second term or a third term in office, on a mission of mercy to help you. orthopedic surgeons intuitively know that the health policy, is the reason that U.S. governors are getting voted out of office, and that orthopedic surgeons are the ones that can help. And we want to help be a part of that solution at Profi.me. We know the Kinetaconter system and the Sir Henry Vane tradition is how we get there. So join us today at Profi.me with the Kinetaconter system, with your master facility plan for your orthopedics practice, for your state.